We are still continuing with the syndromic approach. And in the last video, we are talking about the urethral discharge syndrome. So for today, we are going to look at some other syndrome, which is abnormal vaginal discharge syndrome. And we are going to look at the causes and shall see even how to manage this abnormal vaginal discharge syndrome. So this is one of the symptoms that we have in sexually transmitted diseases. Remember, we said we manage these conditions using a syndromic approach. So what causes abnormal vaginal discharge syndrome? We're saying can be a variety and often mixture of organisms. As we saw in the first video, there are many microorganisms that can cause abnormal vaginal discharge syndrome. Like we talk about bacterial vaginosis. Bacteria will typically be the one causing the problem. So typical vaginal discharge caused by trichomoniasis, and you see on the diagram how it looks like. This is caused by the trichomoniasis. So we are looking at now the signs and symptoms of someone who has abnormal vaginal discharge syndrome. There is yellowish froth and offensive vaginal discharge. Yellowish froth. Froth is what you see here, like foam, as if there is soap which has been applied, which you are saying yellowish froth. And they are saying there's offensive vaginal discharge. It has a bad smell and it irritates the vagina. So there is a yellowish froth and which irritates the vagina. Then there is dyspareuria, and that is painful coitus. Then there is reddened erythematous mucosa, and this is just because of the irritation of the skin. Something to note: male asymptomatic and many females are affected. That's why I was looking at this abnormal vaginal discharge. Most times it is in women, and males are symptomatic. They will not have this problem. So what are the other clinical features? We are saying in all cases, abnormal increase of vaginal discharge will happen. So some client will tell you, I now express increased abnormal vaginal discharge. And we are saying normal discharge is small in quantity and white or to colorless. That's the normal discharge of the vagina. Small in quantity, white or almost colorless. But this one is yellowish and it is too much. Gonorrhea produces a thin mucosa, slight yellow. So this other person may be having gonorrhea, but you're saying in gonorrhea, the discharge has no smell. And what we talked of, it is having a smell. This is most cases of bacterial vaginosis. So we are going to have people have gonorrhea and bacterial vaginosis, all of them possessing yellowish froth, but you are saying we manage syndromically. So we shall just give treatment, not first ruling out whether it is gonorrhea or it is vaginal bacterial vaginosis. So we are saying the female may have an infection and transmit without symptoms. Most females who have this can have the infection and transmit without having symptoms. But most of the symptoms I have seen, there's purulent yellowish discharge from the vagina, urethral discomfort, especially when they are having burning pain on micturition, and micturition simply means urinating. They can have Bartholin infection, Bartholin glands, which are just on either side of the minora. Then you are saying infection may spread upwards. In case people have like trichomoniasis, we are saying for this one causes a greenish yellow discharge with small bubbles, and the smell is fishy smell and itching of the vulva. What about if it is Candida albicans? We are saying it causes a very itchy, thick, white discharge like curdled milk in the vaginal walls. And when it is also mycoplasma and chlamydia, we are saying may cause an unitchy, thin, colorless discharge. All these we have been looking at abnormal vaginal discharge. Different colors, no color, but the vaginal discharge is increased. How do we manage all those people who have abnormal vaginal discharge? Lower abdominal tenderness, and we are saying we are going to treat that lower abdominal tenderness. Here we're going to give analgesics. So if there is no lower abdominal tenderness, but itching, erythema, and accretion, we are going to insert fluconazole as a pessary, or we are going to use fluconazole as an oral drug. But here we're going to insert fluconazole as a pessary, 200 milligrams single dose, or can use metronidazole 2 grams single dose to treat all patients who present with abnormal vaginal discharge syndrome. What if they are pregnant? If pregnant, we are going to replace fluconazole with cotrimoxazole pessary, and that's what you're going to insert at night. Instead of inserting fluconazole in a mother who's pregnant, we're going to substitute it with clotrimazole pessary 500 milligrams single dose at night. And also we add metronidazole only after 1 trimester. So after the first trimester, we can also now continue with metronidazole in a pregnant mother. So if discharge or dysuria persists, we are going to give cefixime 400 milligrams start, and we are saying a class of cephalosporin. Cefixime is from a class of cephalosporin, or we are going to add doxycycline 100 milligrams 12 hourly for 7 days. This in the case that if discharge or dysuria persists, and dysuria, that's painful micturition. And if someone is pregnant but has the discharge persisting and dysuria, we are going to give erythromycin 500 milligrams 6 hourly for 7 days, and treat sexual partner. We treat male and female as a couple. And if discharge and dysuria still persist and the partners were treated, now at this point, we are going to refer to the specialist for management. If there is no lower abdominal tenderness and no itching, we are going to give cefixime, as I've said, 400 milligrams start, doxy, metro. If pregnant, we replace doxy with erythromycin. And we have looked at also, if discharge and dysuria persists, we are going to refer for further management. Thank you for listening. That's how we can manage a person with abnormal vaginal discharge syndrome. Let's meet in the next video as we talk about another syndrome. Thank you and God bless you.